Alright y'all, welcome back to Level the Playing Field, always talking about the highest level of sports medicine content and information. Today we're going to be talking about what are the steps to a successful ACL reconstruction, and even go through a surgical video so y'all can see what the steps look like. So be sure to like and subscribe and follow along. Let's get into it. So the ACL is one of the most commonly injured ligaments out there, right? And it's part of the knee. It's there for stabilizing the knee joint. Y'all have heard about it on the news. You heard about it on ESPN. When it's injured, it's a devastating injury. So before we get into too many details about what surgery is, let's talk about what the ACL is and what it does. Remember, ACL stands for anterior cruciate ligament. That anterior cruciate ligament sits in the middle of the knee. Looking at this diagram here, you can see how it sits in front of the PCL, the posterior cruciate ligament. Always remember anterior meaning front, posterior meaning back. All right, and in the knee joint, you also have on the sides, the medial and the lateral collateral ligaments, the MCL and the LCL. And in between the joint, you have the meniscus, which is sort of like a cushion in between the joint. So that's the basics, ACL, anterior cruciate ligament. And it sits right in the front of the knee, and it keeps the tibia, the shin, from shifting forward or rotating during pivoting activities. So it's very key to any pivoting or quick changes of direction to keeping that knee stable. So if we look at this next picture, what you can see is when the ACL is torn, right, frequently it's torn right through the mid-substance, or right through the middle of it. And you know what causes the ACL tear? Basketball injuries, soccer commonly, football, or sometimes more traumatic things, car accidents, fall from a great height. Anything putting stress on the knee such that it's in a setting where it becomes unstable puts that ACL at risk for tear. So ACL tears, remember, are a devastating injury potentially, and we try our best to prevent them. So the question about ACL surgery comes up as to who needs it and who doesn't. And I'll start by saying not everybody who tears their ACL needs a full surgery. Some people have partial tears of the ACL, right? So a partial tear of the ACL, a lot of times we can treat with rehabilitation, which is physical therapy. We can strengthen the muscles around your knee, make you strong enough to keep rolling, and that's it. Some people don't necessarily do activities that put them at risk for knee instability, right? So if you're not doing a whole lot of cutting, pivoting activity, you may not feel the need to go through a full surgery to deal with the ACL or to treat that. So ACL surgery is not for everybody, but for some people, it's the only way to get them back to the activity that they need or they love, or as part of their career, profession, or part of their school activity, right? So the most common treatment surgically when we're treating an ACL is a reconstruction. So if you look at this next picture, what you'll see is a reconstruction. Rather than putting the ACL back together, a reconstruction is actually rebuilding that ACL, and that's the most common way to treat it surgically. There are a few different ways that we can treat that ACL when reconstructing it. In most cases, we find it best to take tissue from your own body, from elsewhere, and actually move that tissue where your ACL was. That's done by drilling tunnels through your femur, your thigh bone, and through your tibia, your shin bone, and actually running that new tissue through those tunnels, and that's building a new ACL. There are a few common ways we can do that. We can take that by taking tissue from your hamstring, or part of it at least. We can do it by taking some tissue from your patella tendon, that tendon in the front of your knee. So if you see this next slide, what we're gonna see in this video coming up is a patella tendon ACL reconstruction. The patella tendon graft is a commonly used graft for especially high-level athletes. In a lot of cases, we've seen that it does a good job preventing re-tear or re-injury compared to other graft options. Now, what graft option is best for you depends on the discussion between you and your physician. And there are even more graft options that I didn't even talk about today. So, you know, that's an individualized conversation between you and your physician. But this is just to give you all the basics to understand what you're looking at. So if you take a look at the video here, what you're gonna see is there are a few key steps that I break it down to work on an ACL, to reconstruct an ACL. The first step starts with, first off, looking around the knee with our camera, the arthroscope, and making sure everything is what we think it is. That's the diagnostic arthroscopy. Diagnostic meaning looking around and seeing and confirming everything we think it is what it is. Once we've confirmed that, we're gonna then start working on cleaning up the old area where the ACL was. Now, for us to be able to successfully reconstruct that ACL, we need the old tissue, the damaged tissue, out of our way. And we use a few different kind of instruments in there while we're doing that. Keep in mind, this is arthroscopic surgery, meaning it's minimally invasive. So really, I'm really working through two small little holes in the knee to do what I'm doing right here. And I'm using these small, tiny instruments and watching what's happening on a video, just like you're watching right now. So we use these instruments to clean up that old tissue from the femur and the thigh and the tibia, the shin bone, to get it out of the way so we can rebuild our ACL. Once we've adequately cleaned that up, once we've gotten it out of the way, the key now is to drill those tunnels I was talking about. So we use special guides and instruments to drill those tunnels in exactly the right size for each patient. So it's all individualized. There's no one size fits all. Everybody's different when it comes to this. So we start off, in my practice, I start off drilling the femoral tunnel first, on the femur first, and we drill that through to just the right depth for that individual patient, all right? We can then take some stitches, some sutures, and pass them into that tunnel as kind of a holding place. We're gonna use those sutures later on, so we put them in there just to hold them for a second. We then go to drilling our tibial tunnel. So that tunnel going through the shin bone, through the tibia, is drilled up the same way we did with the femur. And in both cases, we're drilling up and then we're cleaning out the excess bone and debris out from inside the joint because we don't want that to stay in there. We get that cleaned up and out of the way, and then we see that we have two clean, excellent tunnels in correct position. Now, a question that comes up a lot is, how do you know where your tunnels are supposed to be? So we have a few different ways we can kind of work on that. A big thing that's become an important thing in orthopedic literature is the concept of anatomic reconstruction. And that means anatomic meaning that we're doing things exactly how the body was to start with, right? So the key to ACL reconstruction in terms of placing the tunnels correctly is to place them where they were before, right? So we want to be in what we call the footprint of the ACL, the footprint being the residual leftover part of the ACL. And we're using that natural anatomy as a guide so we know where we're supposed to be working. So that makes our surgery individualized to each patient. We're not putting it in the same place for every person. We're putting it where you needed it because that's where you had it before. And we're trying our very best to recreate what we call the native anatomy, to recreate what you had before you had the injury and give you an ACL as close to, maybe not identical, but as close to what you had prior to the injury. So once we drilled these two tunnels and we got them set up, the next important thing is to pass our new ACL through that. Now, that graft, that new ACL, like we said, can be taken from a variety of places. In this specific situation, it was taken from a patella tendon. And when we do that, we frequently take bone from both the patella and from the tibia, the shin, and make that part of the graft. And what makes that a strong graft is that you can get bone to bone healing once that graft has passed through. So we prepared the graft already. You didn't see that part. We prepared the graft already, and we're gonna use the stitches, the suture that we passed through the tunnels to pass that through and pull it through. So we're literally pulling that graft through the tunnels to fill the space where the old ACL was. Once we have that in place, what we can do is take screws, plastic screws in my case, it varies by which surgeon's doing it, and we actually put those screws in to hold the graft on both sides, both the femur and on the tibia. And that holds it in place. Now those screws are not gonna hold forever. The idea is that the body will heal those areas in place. So the screws are just there for protection until that can happen. And that process can take anywhere from 6 to 12 weeks. So we wanna be careful during that time period that things heal properly. But once you've finished, you can see the before and after on this next picture here. So the first picture shows you what we call the empty wall sign. And that means that there's ACL missing from the femoral wall. Empty wall sign. Once you see that, we know we've confirmed that ACL is missing. So that's where we started. And where we ended up was in this next picture here, where we have the ACL graft going from the tibia to the femur, and we no longer have an empty wall. There's a nice new ACL there. So then the question is, what happens next? Well, the surgery itself to perform an ACL reconstruction is about an hour, but the rehab to come back from it is over a year for some people. And the reason for that is there is so much that goes into restoring the knee motion, the native knee motion after the injury. There is so much that goes into getting the strength back around the knee after the injury. There is so much that goes into preparing for playing a sport again. So while the surgery itself is not necessarily that long, the entire process is so much bigger than that. And like we talked about in the past, sports recovery has so much more to do than just a surgery. Surgery by itself is never really the answer. It's always surgery with a dedicated team of other individuals. Your physical therapists, your athletic trainers, your strength and conditioning coaches, your sports performance specialists. So our part is only a small part of the entire picture when it comes to coming back for an ACL reconstruction. So to summarize, the important parts of performing an ACL reconstruction: deciding what type of graft the patient's going to use based on their preferences and what they need, preparing the area where the ACL was, that's cleaning up the femoral footprint and the tibial footprint, drilling tunnels on both the femur and the tibia, and then taking that new graft and passing it through the tunnels to rebuild that ACL, that reconstruction. So remember that and take that home. The most common treatment for an ACL rupture surgically is ACL reconstruction, rebuilding the ACL from tissue that comes from elsewhere in the body. So continue to follow us, like and subscribe. We got more content to come and more videos to follow. See you next time.